Ice pick scars are really hard to treat because they're so deep, and they bother patients because they're not the type of scars that you can easily cover and they're noticeable. So what I like to do is TCA cross. Cross stands for chemical reconstitution of skin scars, and what we use is TCA, which is trichloric acid. And you want to use a high concentration of this very strong acid. So studies have shown using between 65 to 100%. Personally, I use 80% and have gotten great results. What you want to do is isolate the scars that you're treating and then use either a wooden applicator with a sharp end, or I use toothpicks. And you want to put a small amount of the high concentration TCA into the base of the scar. And then we wait. So you wait for this frosting to appear. A white frost appears with surrounding erythema. You wait for the frost and then you just let it be. You're not wiping it off with anything. You just let the frost be, and then you tell patients to apply plain Vaseline. What you don't want to do is keep reapplying the TCA. A lot of people double dip and you just keep dipping into the scar, and if you do that, what you're doing is just causing more damage, and you can end up with ulcerations and necrotic scars as a result. So a small amount into the base of the scar and wait. And then I just have patients apply plain Vaseline afterwards, and it all heals within a week. What I don't like this for is for treating darker skin types. So in treating skin types 5 and 6, there's a risk of causing hypopigmentation. So I really don't use this method for treating those patients. Typically you need more than one treatment, as with all other procedures that we do. And after about 3 to 5 treatments, patients do have more than 50% improvement. So if someone comes in wanting to get the ice pick scar removed and doesn't want to do a series of treatments, doing a punch excision is optimal, and also for the darker skin types, because you just punch it out and then you're left with the small scar that you've created from the punch excision. What I typically do is when patients come in for suture removal after having done a 2mm punch is that I treat them with a non-ablative laser at that time, and that helps with the appearance of the scar that I just created. I wait 1 week because I have the sutures in for 1 week. So at the 1 week mark, I'll remove the sutures and then at that same appointment, do the laser treatment. It's hard to compare the two head to head because with the TCA, you're building collagen from the inside up. So you're gonna see some shallow scars as a result. But with the punch, you're completely removing that scar. Now, the question lies in how do they heal from that procedure you just did with the punch. Some patients heal beautifully, and when you laser over it, you can barely tell. But other people, they could have a spread scar or little atrophic scar that's developed at the punch site. So sometimes scars can get worse, especially if you do a surgical excision where it's a larger area that's being treated. Even if you do everything right, these patients have some kind of unusual healing or abnormal inflammatory markers that are overexpressed, causing them to heal the way that they do. So they can develop some atrophic scarring after the treatments. Options that we have are doing laser treatments or using fillers. I use hyaluronic acid products.